Said, little bitch, you can fuck with me if you wanted to. These expensive, these is red bottoms, these is bloody shoes. Hit the school, I can get them both, I don't wanna choose. And I'm quick, cut a nigga off, so don't get comfortable. Look.
Excuse how I look, but you guys know I don't care. But this is that white stuff is some edge protector. I keep in my hair so the stuff won't tear my hair out when I take my wigs off. So anyway, yes, I just got my first appointment for whatever that's going on in my life. So happy about it. So stoked. So excited. So, and I got another appointment on Monday. So, anyways, I gotta go handle some stuff by Harmony going to school. So I will see y'all later and talk to y'all later today. Sit down, fat girl. It's a website. Just put your name in. That's what I did. And find a few of them got some. I'll talk to you about that in a minute. Hey guys, your mama is back here in the doctor's office, and we're here to see what's what. Me and my big bud. And hello, mother. So I gotta get my referral to send to the place. I told you I'm not saying no names yet until everything is started. I can actually start my vlogging journal of this. And when I start that, then I'm gonna have mother to tell her story because she did something as well. And then when she told her story, then her story scared me, but her doctor was kind of like one of them doctors from the DR. They don't know what they was doing, but But now in the DR, there's a lot of them know what they're doing. Cause I'm trying to get over there too to get me a tummy tuck. But hey, one thing at a time. Hey, baby. Alright, we'll be back, you guys. We can't record once they get in here. So, I'm gonna have to turn the camera off. So, I'll see you guys.
November. It just seems like forever.
Oh my God, I know it does.
How have you been?
Good.
Good?
Good.
Now, you say that so slowly, and I'm supposed to believe that.
I was just thinking, cause like, okay. Remember last time we talked about the weight?
Yes, ma'am. You were planning to do a surgery, weren't you?
Yeah. And I remember, and you told me don't do the tummy tuck. You think I should do the
Consider
bypass
that, at least
before,
consider it.
right?
Yeah.
Before I do the tummy tuck, and I took that into consideration.
Okay.
And finally, oh no, I'm terrified of surgery. I was even terrified of my C-section. So
Okay.
I cried probably the whole time while they was doing it. The nurses holding me, but I said, you know what? I'm just 31 years old. I have 4 children, 9 and under. There's my reason I can't play with them, be out of breath. And I said, I got to. And especially weight, plus size, big in my family, huge. And my grandma has high blood pressure, diabetes in my family badly. And I'm already at 304. I can't. And she know I had a breakdown. We was in the dressing room the other day. And now I'm a 24 pants. I have never been that big. And that just broke me down. I said, that's it. I got to call.
All right. That was your moment.
Yeah.
That was the moment that it turned around and you said,
yeah, I cried. I'm about to cry now. It hurt me so bad. I said, Mom, I've never been a 24.
Let's turn that hurt into motivation. All right. So you wanted to discuss a referral. Tell me what you're thinking.
Yeah, well, I'm thinking about the bypass surgery. Got the bypass.
People who have bypass surgery are very ill people. They lose the weight, yes, but they end up with a lot of complications because they cut out a portion of the stomach that's very important, and it's the portion of the stomach in which we absorb our vitamin B12, our vitamin D, our zinc, our copper. So we end up with a lot of malnourished patients. We end up with a lot of patients who are chronically anemic, who can't absorb iron, so they end up having to do iron infusions.
I have that problem now.
It's really moved away from, you won't see a whole lot of surgeons recommending gastric bypass surgery, and if they recommend that as a first choice, I would certainly advise you to consider a second opinion elsewhere.
Okay.
Gastric sleeves have become kind of the new wave of bariatric surgery. We don't see as many complications from that surgery, and we still see great results from that surgery. So if surgery is an option for you, then let's get you to a bariatric seminar.
Yeah, I have my first appointment with the how you pronounce it again?
Bariatric.
Bariatric with them on Monday at 11.
Who are you going to see?
I want to say it was, what did I just say? Dr. Wright or something?
Dr. Wright. So you're going to Capital Regional Medical Center then?
Yes.
All right. Have you done the seminar yet?
Not yet.
Okay.
I have my first appointment the Monday, and I guess I'll just go from there.
Okay. There's a seminar that they do. I believe it's the third Thursday of each month. I'm not absolutely sure, but if you Google Capital Regional Medical Center, it'll probably come right up on their website.
Okay.
So consultation with them is one thing, but you might want to consider going to the seminar as well, just to get a little bit more information. The seminar won't cost you anything. They do actually ask you to register so that they can make sure you have a seat available.
Okay.
But it gives a lot of people a lot more insight about different types of surgeries, what your options are, what are the benefits, what are the complications for it.
Okay.
And you'll probably get a lot of that in the consultation 101 with Dr. Wright. But when is your appointment with him?
Monday at 11.
Okay, all right. So probably just go with the appointment first, and he may ask you to come to the seminar or not, but we'll see how that goes.
Okay.
Now, there are patients who want to do surgery. There are patients who don't want to do surgery. But we know that weight issues are not just an acute issue; it's a long-term issue. How long have you battled with weight?
Since a teenager, probably
Right,
since
that's what most people tell me. Pretty much
about 14, 15.
Yeah, that's pretty much what people tell me. And a lot of times you get frustrated because you go to these different places and they tell you, oh, you need to eat this, or you need to exercise, you need to eat this, you need to exercise. It's not always just an eating problem and an exercise problem. You already tuned me into that when you told me that there's a family history of obesity, right? It's a genetic problem and it's a metabolic problem.
And I even went to the weight loss clinic with Dr. Morales.
Yeah, but what do they do in those weight loss clinics? They give everybody a B12 injection, everybody goes
those
home
pills.
Everybody loses weight for a couple of months, and then as soon as you get off of the injections, as soon as you stop taking the medication, it goes away. Again, it's not an acute problem, it's a long-term, it's a chronic problem that we need to address, and we have to start thinking about weight issues like we think of diabetes and like we think of hypertension. If you came into my office and I told you you were diabetic, I'm likely to give you some medications. But once we get the diabetes under control, I'm not going to stop those medications, am I? Because the diabetes is not going to go away. It's going to continue for the rest of your life. So I'm going to continue to manage your diabetes over time. Right? And it's the same thing with weight. We can't just give you a pill and give you a shot for a couple of months and then stop and don't do anything else. It doesn't work that way. It's a lifelong issue that we're going to have to address, and we have to treat it like we treat chronic medical illnesses. All right, so I would suggest you also go to the Bariatric Center, and Dr. Wright is very likely to tell you the same thing. People who want to go to surgery, people who don't want to go to surgery, I tend to send them to the Bariatric Center because they understand that long-term care with weight management issues.
Okay.
Dr. Lang is a physician over there. She and I actually trained together. She's over there. She has a nutritionist, a dietitian. They have an exercise physiologist, I believe, and they also have a psychotherapist because many of our eating issues, many of us don't even realize we have an eating issue. Many of us have bulimia. Many of us eat under stress, and we purge on carbs. Many people have anorexia, and that one might be a little bit easier to identify. But if you have someone with an eating disorder, you're never going to cure their weight issues with diet and exercise. You have to address whatever the psychosocial issues are with them before you can get them to a place where they can maintain their weight loss. So I like the fact that they have a multidisciplinary team over there, and I like the idea that they follow you over the long course of time. So again, there are patients that want to go to surgery and patients that don't want to consider surgery, but they manage all patients who have weight issues. And with the bariatric surgeries, most often the surgeons tell patients, let's get you to the bariatric center so they can go ahead and start you on that process before your surgery, but let's keep you tied into them after your surgery so we can make sure that you're maintaining that weight loss.
And that's that 6-month thing you were telling me about? Or no, that's something different?
Well, it's a long-term center, so it just depends on what your needs are. Okay. It depends on what your needs are. Some people can go there for 6 months and they get things going. Some people it take a little bit more time, but I've had patients, even without surgery, lose 85 pounds by going over there. All right? So I think that would be a great idea in addition to you seeing Dr. Wright.
Okay.
What else? All right. Now, there are a couple of things that we need to do before we get all of this stuff underway. Your blood pressure is reasonable, 128/70. We'll probably see that the blood pressure continues to go down as you lose weight, right? But let's check you for.
So that's high?
It's not high. It's okay. It's a decent blood pressure. For a 30-year-old, I'd much rather see your blood pressure somewhere in the 1 teens or lower 120s, but 128 is still within the normal range. It's just at that upper limit of normal.
Okay.
So we'll probably see it come down as your weight starts to come down. You start exercising and getting.
I exercise so much. I walk so much, but like the last time I stopped on it was you're about to kill yourself, and I'm like,
are you doing just a walking? Has that been your?
I'm walking, and it's and I jog. But that's it. I do some leg workouts at home, but.
Have you done any weight training?
No.
Got to get into weight training. Here's what we forget about with exercise. When you're exercising and you're doing your cardiovascular activity, you're walking on a treadmill, you're jogging, you're doing whatever it is to get your heart rate up. Yes, you're burning calories, but you're only burning calories at that moment in time. So the minute you stop walking, the minute you get off the treadmill, that's it. You're not burning those calories anymore. So that's why we have to weight train.
Okay.
Because weight training is going to get your metabolism up, and it's going to keep your metabolism up as you continue to go through the day. All right, It's going to make people feel slimmer. A lot of people get a little bit annoyed when they're starting to exercise and they're starting to do weight training because they feel like their weight goes up instead of coming down. But you have to remember that we're replacing that fat with muscle. It's going to be heavier when you get on the scale, but your clothes are going to fit a lot more loose.
Gotcha.
All right, and then as you keep going with it, you're going to notice that the weight starts coming off a lot easier. All right, but walking is certainly good. You certainly want to do that walking, but try to start thinking about doing some weight training that you can incorporate with that. But before we get you over to the Bariatric Center, before Dr. Wright will even touch you, we got to figure out if we have any other metabolic issues going on. So looking back at your labs from last October, we had a little bit of iron deficiency anemia going on. Cholesterol looked great. And then your thyroid was good too. So we need to repeat those labs, but we also need to check some B12 studies, some vitamin D levels on you. We need to do some iron studies on you again and see where we are. If we have any problems or deficiencies with those labs, we'll need to correct them before you do anything at all.
Okay.
All right, and I'd also like to have the labs done before I'm sending patients to the Bariatric Center so that when you get there, they already have the information to get started. You don't have to see them, go back and get labs, and then go back to see them again.
Okay.
You're ready to move on this, right?
Right.
You're motivated.
Very.
You're going to do it.
Yeah.
All right, so
Definitely.
work on keeping a food log and an exercise log. So every day when you walk, do you have like a Fitbit or something that you count your steps with, your cell phone maybe?
Yeah, myself. I had it downloaded. I took it off now.
All right, well, put it back on
Got
there.
activated.
Get those steps in, count those steps, log those steps into a little diary.
Okay.
Log all your exercise into a diary, what you did, how often you did it, how long you did it. Write everything down that you eat.
Okay.
All right, because you might be surprised that we're extra.
We are in the bathroom. Mommy had to go to the potty. And here's my outfit. Yes, to that booty. To that booty. Anyway, so the doctor and I, you heard we talked about the sleeve, about the bypass, and all the other stuff, and you know, so basically I'll make a second video, and then I'll talk about it more on there because I did a long video already of like what went on in the room. So once I do that, I know I play my hair a lot, but it's so silky. It's so silky and nice. And I'll talk to you guys later. What, this? The little clear thing? Yeah. And that's about it. So Mother and I are gonna go. And I'll see you guys in the next video tonight. Bye.